In the Bible, Psalm 139, verse 14 to be exact, we are reminded that we are fearfully and wonderfully made. Back when that verse was written, not much was known about the human body or how it worked. We know much more today, but still, we should not assume that we know everything. Neither should we dismiss certain natural health methods simply because we don't understand them. Applied kinesiology is one such mysterious method administered by Dr. Ken Haas, who's about to give you a health awakening. All right, welcome to the Health Awakening. I'm your host, Scott Laird. You may recognize the word kinesiology from a class in high school or college, but applied kinesiology is something completely different. In fact, applied kinesiology may be the mysterious answer you're looking for if nothing else from conventional medicine seems to help. Applied kinesiology, or muscle testing, as it is also known, looks admittedly very strange to those not accustomed to regular medicine. It can look nothing like more than a balancing act mixed with a placebo effect. In other words, it can look like it's all just in the person's head, until that is you experience it for yourself. And that is exactly what we're going to do today on the show. Our guest today is Dr. Ken Haas. He is a chiropractor who also employs many other wellness protocols, including applied kinesiology, a science that uses bioenergetic feedback through testing the strength of various muscles in the body. This highly individualized, in-depth system of analysis allows the doctor to assess various aspects of a patient's state of health. And to tell us more about it is Dr. Ken Haas. Welcome.
Hi, Scott. Thanks for having me.
Certainly, certainly. So now, before we turn the cameras on, we mentioned that, well, applied kinesiology is not really mysterious. It is, in fact, a very serious science. Can you explain more?
That's correct. There's actually an International College of Applied Kinesiology. Kinesiology has been around since the 60s and was discovered by a doctor in Detroit named George Goodhart, and who, with very careful and meticulous trial and error, developed the beginnings of this science. And there are papers that are peer-reviewed, and it's built into a large body of information.
So it's taken seriously now. Like you said before, a chiropractic used to be seen as junk science, and it is now recognized that, no, this is a serious and very valid medicine.
So, you know, chiropractic, again, has been assimilated into our culture. Insurance companies pay for chiropractic care, and somewhere between 20 and 40% of chiropractors have some knowledge of applied kinesiology and use it to some degree. So it's part of that system, and so if you want to talk about being legitimate, I mean, I guess that's where you would get it from.
Okay, so now how would you determine if someone comes into your office and they're just there for a chiropractic adjustment, how would you decide that that person would be a candidate for applied kinesiology, that they might need this?
Well, everything that I do is somewhat mediated by applied kinesiology techniques. So kinesiology is using the body as and the muscles and neurological system as a feedback tool. So you're, in essence, asking a question. Okay. So if you're going to do, if you're looking to do just a chiropractic adjustment, and let's say you're looking at the cervical spine, you can literally touch a bone and muscle test and see whether or not it's in place or out of place, or even precisely what direction to make the correction in order to get the best result.
Okay, well, how did you get involved in this to begin with? Obviously, you were a chiropractor at first, and then you've had many other things.
Oh, I started out as a patient.
Oh, did you?
Yes.
Okay.
Yeah, and in college, I was an international competitor in gymnastics. When I got to the ripe old age of about 21, I was battered by injuries and had to retire, and I hobbled around for many years. And I was a professional coach, and I got introduced by a great doctor in Massachusetts, Dr. Shotsky, who did kinesiology. He wasn't my first stop. I was just wowed by what he did, and he made me so much better. I even came back and did some masters competition as a result of that, and I decided at that point I wanted to be like him. I went to chiropractic school to do chiropractic, but really I wanted to do kinesiology.
Really? So this was even before you got into chiropractic?
Oh, yeah. And I was actually a little shocked when I got to chiropractic school that it wasn't more widespread, that there were a lot of other techniques that were better populated by the student body.
Right. And even now, I'm thinking not many people are maybe familiar with this type of protocol. So how reliable is it? I mean, some people see it and they don't know what to think of it. What would you say about the reliability of this?
You know, there's been scientific studies about validity and reliability, and it comes out pretty good. And it's also who's doing it. You know, I've been doing this for 34 years almost now.
Wow.
When I was first out of school, I probably wasn't as good as I am now. And, there's also judgments that you have to make. When you do, and we're going to demonstrate some tests in a little bit. When you're doing this, you have to take other things into consideration just as, when you go to a medical doctor and, one lab test does not determine the whole picture. You have to look at a consultation and a physical exam and other things. So, that takes some judgment. And I think, the older guys, maybe because I'm old, it's better.
Gotcha. Okay. Well, we are talking with Dr. Ken Haas about the incredible science of applied kinesiology. We're actually going to be doing some of this in a little bit. And we're going to take a short break, but stay with us. We'll be right back, and you can see applied kinesiology on The Health Awakening. All right, welcome back to The Health Awakening. Before the break, we were talking with our guest, Dr. Ken Haas, about applied kinesiology, what it is not. And I thought, well, we should just do some on stage here and demonstrate what it looks like and what it can actually help people with. So now you said the first thing when you're talking to somebody about applied kinesiology is establishing a baseline. What does that mean?
So we want to see if somebody's actually testable, if they're responding normally, because what we're doing is we're trying to create a circuit. We're creating a circuit, let's say from your brain. We're going to use your shoulder muscle just out of convenience.
Okay.
And so if we start with a nice straight arm.
Okay.
And I want you to hold that arm nice and strong for me. Something in your brain is telling your shoulder to turn on.
Gotcha.
So one of the things we want to do is see if we can break the circuit. And there's a point right here on the bridge of your nose. It's called the master point. And so if I just contact that and have you test, and you get real weak.
Wow, look at that. Now I'm trying to stay up here. It's not like I'm just letting it down.
And now normally I'll do this several times. Hold strong.
Okay.
And I'm really leaning in, and then hold strong, and that just makes you very ratchety.
Something.
And so it's kind of like a circuit breaker.
Okay.
And so there's times when people's circuits don't break, and it could be for several reasons. They're dehydrated, they don't have enough enzymatic activity, there's a magnetic problem, there's an adrenal problem. So we run through those if that doesn't work. And we test a few other things to get a baseline. We test acupuncture points on your clavicle called K27, and we look for adrenal fatigue. So adrenal fatigue is one of the most common things that we see. Hold strong, do it again. And if we just stretch your ligaments, just like that, hold strong, don't let me push. And then so you're in adrenal fatigue. Now that's always a good bet for me to demo on somebody, because it's pretty hard to find somebody who's not run down because of the way that we operate in our society. Working too hard, not resting enough. There's lack of balance in most people's lives.
Is it also to do with diet and not exercising, all that type of thing?
Everything plays a role. Lifestyle plays a role. What happens to you if you had a family emergency, somebody passes away, financial problems that everybody has, I run a business. I work 60 hours a week. I have 5 children. It's hard for somebody like me not to have some adrenal fatigue. So I have to support my adrenals all the time.
Okay, so how do we do that? How do we support? Or actually, maybe I should ask you, what comes next after
So what comes next? So now what we want to do is identify certain problems. So one of the things that we can do is look for things that may or may not be toxic in your life. And so we can actually, I have brought with me some samples of things that are nutrients. Some of them are foods. These are actually emotional balancing. They're Bach flower remedies. And so we can actually see if we get something like this even in your energetic field.
So I just hold this against me.
Yep.
Okay.
And then we just test, and let's say, and we get some weakness. So something in here you're not happy with.
Oh.
That's all that tells me.
Really?
And then what we can do is we can go through and we can actually test each individual vial, and that would be a way to see, okay, let's make something up. Let's pretend it's cinnamon.
Okay.
And so I'll pull the cinnamon vial out. Now, let's find out what reality is. Cinnamon does not bother you.
Okay.
But we'll pretend it does, just for the demo here. So you're real weak with cinnamon.
Okay.
Now we have to do a couple of things. One is we could say, avoid cinnamon. And that's not terribly hard to do. But when it's something that's more common in our lives than cinnamon, let's say it's quinoa or wheat or dairy or something like that, and those are things that are a little harder to avoid, then maybe we need to do a desensitization treatment on it.
Gotcha.
And we're going to maybe demo some of that later on.
So would this be, like my daughter has a peanut allergy, for example, and she was tested many years ago with the little needles in the skin to see what reacted. Would this be a different way to test for a peanut allergy or something to that effect?
Yeah, so I like to call this sensitivity testing because not all sensitivities are allergies.
Okay.
All allergies are sensitivities, but not all sensitivities are allergies.
Okay.
And so there's a scientific definition of an allergy where there's an antigen and an antibody. So this goes a little beyond that.
Okay.
So now it gets to be a little more mystical when we talk about it that way. But so if we're comparing skin testing and blood testing, and I've done that, doing not only our hands-on muscle testing, but we do computerized testing as well, and they stack up pretty close.
Really?
So surprisingly well.
Okay.
Because I remember the first time I did that, I go, oh, well, that really works. And I was a bit surprised. So yeah, it's good. But one of the things I always tell people is I don't rely on this 100%. If I desensitize your daughter for peanuts, I'd still tell her never to eat a peanut. You don't want to tempt fate. You know?
Right. So what comes next after this? What would you...
So there's a number of things. This is a little better demo that we might be able to do. And I brought with me a little meter that I use to demonstrate electromagnetics. We use this thing just to demonstrate electromagnetic fields. And so I put my phone up here, and there's an electromagnetic field. You can see it's gone on and off because your phone is constantly checking the internet to see if anything's coming in.
Right.
And so the reason I do that is just to show you that the phone has an electromagnetic output.
Wow.
And so what we want to do is we want to see what that does to you.
Oh, all right.
So if we get you nice and strong, so we start with a baseline.
Yep.
Turn the light on. I'll do it this way. And then we'll put the phone right up to you, holding that nice and strong.
Okay.
Yeah, you don't even
have
to
not hold
touch
the phone?
it.
Okay.
So I'm not even touching you, and it's affecting you.
That is
Make
something.
sure that light stays on. So we can actually figure it. Well, it's about a foot where it starts to affect you. So now, as I said before, we want to look for something that's going to negate that. And so what we can use is something called a multipolar magnet.
Okay.
So just hold that against your body.
All right.
And see if that raises your electromagnetic potential, and then you're much stronger when we do that.
Look at that. Now this is just like a little, it just looks like a piece of fabric or something.
So the magnet's under the fabric, and it has little cells in it that are north and south and north and south. Most magnets are north on one side and south on the other. So it's got both north and south on each side. And that's the benefit of something like this. There's other devices you can use, but these are really inexpensive. That's why I like them.
Wow, that's fascinating.
Just keep it in your pocket, and that's always in my pocket.
And that just keeps your electrical flow more in tune with the earth? Is that what it's all about?
I think it raises your electromagnetic potential, so it's harder for something from the outside to overcome you.
Gotcha.
You know, if you were standing in the middle of a power substation, it's still going to knock you flat. So.
Okay, wonderful. All right, well, we're talking with Dr. Ken Haas about the incredible science of applied kinesiology. We have to take a short break, but stay with us. We'll be right back with some more.
So let's go right here, and we get a little weakness. So that's your adrenal glands, and then we're looking for something that can strengthen it. Let's try that and see if that makes you stronger. Yeah, so that's much better. Good.
And welcome back to The Health Awakening. Before the break, we were talking with our guest, Dr. Ken Haas, about applied kinesiology. We actually tried some of it on stage, and I was just telling Ken that I used to have one of those magnets in my pocket, and it would help me with fatigue. What else can kinesiology be used for other than something like that?
So in our office, we work with 6 categories of problems. Structural problems, like problems with your spine or your muscles or injuries, things like that. And so you can test. We talked about testing on a bone. You can test every vertebra. I'm a chiropractor, right? So when I adjust people, I always check, is it this bone? Is it this bone? Oh, it's this bone. Do I need to go this way? Do I need to go that way? Do I need to go up? Do I need to go down? And so that helps not only find the problem, but determine exactly which way to correct it. You can turn muscles on. You can turn tight muscles off. There's things that you can do like that. We look at electromagnetic problems, and so magnets are one of the ways that we do it. We also look for people whose whole electromagnetic system is low, and then we have a device that helps bring it up, pulse magnetic field therapy. Nutritional deficiencies or imbalances. So we can test, let's say we test and we find that your thyroid tests weak. Well, what are the things that make a thyroid work better? It could be iodine, it could be selenium, it could be fatty acids, it could be a number of different things. So there's a series of things. Oh, well, that makes it better? Okay, we're going to use that supplement, and you can even figure out dosages and things like that. We look at emotional stress. So we can say, okay, think about your wife, and you go like that. And now let's say if we can figure out a way to deactivate that, and there's acupuncture techniques, tapping, a lot of people know about EFT. Is that something you're familiar with? So there's techniques like that that have been around since the mid-'80s.
That's an emotional freedom technique, EFT? Okay.
Yeah, it started with a book called The 5-Minute Phobia Cure that was written by a psychologist who did kinesiology in 1985. And then he's kind of out of the picture now, but you know, it's kind of mushroomed. We can look at allergies and sensitivities. So we did that, let's say, with the cinnamon. And then you can either avoid things, or we have techniques to desensitize. And then the last part is toxicity. So there's environmental things. You know, babies are born now. Mother's milk has about 220 some odd toxins in it routinely that weren't around. Let's say I'm 61 years old. When I was born, toothpaste was white. We didn't have Fruity Pebbles cereal. We had
right.
Rice Krispies or Corn Flakes. What do you want? So the environment is a lot different, and we routinely test for toxins and heavy metals, and I do lab testing for heavy metals on almost every patient, I would say, probably. We find people with mercury and arsenic and lead. You know, around here in this area, there's a lot of arsenic in the ground, so if people have a well, we find arsenic toxicity. There's high levels of manganese, which is a nutrient, but in high levels will cause neurological problems, and it's just in the rocks. I've seen kids here with uranium. I've had 2 people with high levels of uranium. Every rock has uranium in it. But if you stir up the ground near your well, you can get uranium toxicity.
Wow, that's amazing. So it's not necessarily, a lot of people either, if they feel bad, or if they've got a gut issue, well, they take probiotics or something. So they just guess their way through it, but that's not really the best way to go about it. You could be far more exact doing something like this.
Well, you can, and you know, if you have a gut issue, taking probiotics is a great idea to do, and I would suggest anybody try it. But you know, it's when things, you know, the simple things don't work, then you got to go a step above. So that people with gut issues, I have a lady right now who's got a chronic bacterial infection. So and antibiotics didn't fix it, but why is the bacteria growing there? And toxicity can be a causative factor, because pathogens like it when you have a lot of heavy metals around. You see a lot of yeast problems and bacterial overgrowth when people have mercury and things like that floating around their body.
Is that because it impedes the immune system and it can't fight back? Is that a part of the equation? Or?
And that's the problem. A lot of times there's several factors. And if you find somebody who has digestive problems, it could be because they have a terrible diet, and you always want to fix that first. You know, most people get better when you improve their diet. I mean,
well, it's the fuel going in, right? I mean, that's what we run on. So
exactly, and also not the bad things going in. You know, so if you're drinking purple Kool-Aid, there's things in there that may not be good for you. But you know, some people tolerate that, but other people don't. Everybody's different, and so you have to look at genetic predispositions. You know, why in my world I see lots of autistic children. Every mother that's ever come to me has said my kid was fine until the vaccination. But lots of people get vaccinations and don't have that problem. So there's some kind of genetic predisposition that you didn't know about until you came in contact with that toxin. I have a problem with mercury. I've had an autoimmune problem from mercury, and but I wasn't born with mercury. It happened to me somewhere along the line. Somebody put a root canal in here that had some mercury in it, and that really threw off my immune system.
Wow, amazing. Okay, well, thank you, Dr. Ken Haas. We're going to talk a little bit more right after this. And welcome back to the Health Awakening. I'm sure lots of people like yourself are wondering, where can I learn this neat stuff? Dr. Ken, what do you say?
In our office, from time to time, we do some intro, how to do this at home sort of thing. If you want to learn a little more higher level, there's an organization called Touch for Health, and they offer classes and series of classes for higher learning of that. And that's about it, unless you're a doctor.
Okay, and you would just Google that, and you'd probably find where you need to go.
Exactly, yes.
Okay, all right, great. Well, thank you for joining us today, Dr. Ken. Our guest today has been Dr. Ken Haas. You can catch the replay of this episode and see our complete show schedule on avivtv.com. And you can see all that Dr. Haas has to offer, including applied kinesiology services, at haaswellnesscenters.com. And we'll see you next time for another Health Awakening.